Nasa hukay ang isang paa ng isang inang nanganganak. This is a common Filipino saying about pregnancy. Sadly, in some communities, when mothers die due to childbirth, it is seen more of a fate rather than a health and human rights issue which needs to be addressed. It is a fact that there are risks in pregnancy. However, there are ways to minimize these risks. A woman's death due to childbirth and its complications should not be seen as a normal thing. Pregnancy is not an illness or condition which women should be dying from. Every woman has the right to health, to have a healthy pregnancy and safe delivery, the right to quality maternal health care, and the right to make decisions about their own health. Unfortunately, this remains an ideal and not a reality. Unavailability of services and proper information, existence of laws that are discriminatory against women, and inequalities at home and in the community are just some of the factors which prohibits them from realizing these productive health rights. What is maternal and child health services? According to World Health Organization, maternal and child health services can be defined as a promotion, prevention, and therapeutic rehabilitation facility or care for the mother and child. Improving the well-being of mothers, infants, and children is an important public health goal for the Philippines. Their well-being determines the health of the next generation and can help predict future public health challenges for families, communities, and healthcare system. The objectives of the maternal, infant, and child health topic area address a wide range of conditions, health behaviors, and health system indicators that affect the health, wellness, and quality of life of women, children, and families. What is the goal and objectives of maternal and child health services? The goal is to reduce mortality and morbidity among mothers, infants, and preschool children. On the other hand, objectives are the following: to improve child survival, to promote reproductive health or safe motherhood, to ensure birth of a healthy child, to prevent malnutrition, to prevent communicable diseases, to facilitate early diagnosis and treatment, and to carry out health education and family planning services. Organizational activities of maternal and child health services: complete health checkup and care of the child and mother from conception to birth, studying the health problems of mother and child, providing health education to parents for taking care of their children, and training professionals and assistant workers. What are the available maternal and child health services in the Philippines? Generally, we have three. The first one is the prenatal or antenatal care services. The second one is the intranatal care services. And finally, the postnatal care services. Through prenatal care, diseases which may lead to complications can be detected and managed early. Women are also informed and educated on danger and emergency signs and symptoms. She and her family are also being prepared for childbirth and at the same time receive recommendations where to seek treatment if complications arise. Steps to follow in prenatal care. Number 1. Do a quick check for emergency signs. Emergency signs include unconsciousness and convulsions, vaginal bleeding, severe abdominal pain, also looking very ill, severe headache with visual disturbance, high fever. and severe vomiting. Number 2, make the woman comfortable. Greet the woman, make sure the pregnant woman is comfortable, and ask how she is feeling. If it's the first visit, register the woman and issue a mother and child book. Number 3, assess the pregnant woman in terms of her pregnancy status, birth, and emergency plan. All pregnant women are at risk, so encourage all pregnant women to deliver in the health facility. Always record findings. It can help you make the right and timely decisions on the care of the woman and her baby. Number 4, get baseline laboratory information of the woman on the first or the following visit. Number 5, check for gestational diabetes. Number 6, check for pallor or anemia. Number 7, check for hypertension or preeclampsia. Number 8, check for fever, burning sensation on urination, and abnormal vaginal discharge. And number 9, immune against tetanus.
Intranatal care. Step 1. Do a quick check for emergency signs. Emergency signs includes severe headache, severe abdominal pain, severe vomiting, vaginal bleeding, and fever. Step 2. Make the woman comfortable. Greet her, make sure she is comfortable, and ask how she is feeling. If a woman has had no prenatal visits, register the woman and issue a mother and child book. Step 3. Assess the woman in labor. Take the history of labor and record on the labor form. Review mother and baby book or facility prenatal record. Observe the woman's response to contractions. Check abdomen, feel abdomen for contractions, fetal life, fetal presentation, and fetal movement. Step 4. Determine the stage of labor. Check the signs, then classify and manage each stage of labor. Step 5. Decide if the woman can safely deliver. Step 6. Give supportive care throughout labor. For pain and discomfort relief, suggest change of position, encourage mobility, and encourage the companion to massage her lower back if she finds it helpful. Step 7. Monitor and manage labor. Monitor and assess the progress of labor. Delivering the baby. Ensure controlled delivery of the head. Feel gently around the neck for the cord. Await spontaneous rotation of the shoulders to the antero-posterior position within 1 to 2 minutes. Apply gentle downward pressure to deliver top shoulders, then lift the baby up to deliver lower shoulder. Delivery of the placenta. Clamp the cord close to the perineum and hold it with one hand. Await for a strong uterine contraction. As the placenta is coming out, catch in both hands to prevent tearing. Step 8. Monitor closely within 1 hour after delivery and give supportive care. For the mother, check for vaginal tears and bleeding, and then clean the woman and make her comfortable. For the newborn, gently clean the baby. Examine the baby thoroughly. Keep the baby in skin-to-skin contact with the mother. Step 9. Continue care after 1 hour postpartum and keep watch closely for at least 2 hours. Step 10. Educate and counsel on family planning and provide the family planning method if available. Ask what are the couple's plans regarding desired number of children. Give relevant information and advice. Advise that exclusive breastfeeding is the best contraceptive in the first 6 months. Step 11. Inform, teach, and counsel the woman on important MCH messages. Talk to the woman when she is rested and comfortable. Encourage them to participate actively in discussions and to ask questions. Step 12. If the woman delivered in the DHS, discharge the woman and her baby.
The following are steps to follow in postpartum care. First, do a quick check for emergency signs like unconscious or convulsing, vaginal bleeding, severe abdominal pain, looks very ill, severe headache with visual disturbance, difficulty of breathing, fever, and severe vomiting. Second, make the mother comfortable. Greet her, make sure she is comfortable, and ask how she is feeling. If first visit, register the mother and issue a mother and child book. Third, assess the postpartum mother and her baby. Fourth, check for pallor or anemia. Ask about getting tired easily or shortness of breath during routine work. Look for conjunctival pallor. Look for palmar pallor. And count the number of breaths in 1 minute. Fifth, treat for intestinal parasites. Give mebendazole 500 mg tablet, 1 tablet, single dose if none has been given during pregnancy. Sixth, prevent anemia with iron or folate supplementation. Give iron or folate 60 mg tablet, 1 tablet daily to last until a scheduled return visit. 7. Give vitamin A if none was given postpartum. Check if mother has already received vitamin A postpartum. If none was taken, give vitamin A once within 6 weeks after delivery. 8. Counsel on family planning and provide the appropriate family planning method if available. Ask what her plans regarding having more children or desired number of children. Give relevant information and advice. Help her to choose the most appropriate method for her and her partner. 9. Provide health information, advice, and counseling. Discuss first the topics that are most important to the mother during the visit. Cover other suggested topics once main concern of the woman has already been addressed. Spend more time on nutrition, education, and counseling on very thin women and adolescents. Important information advised postpartum. Hygiene for the mother and the baby. Keeping the baby warm. Care of the baby's cord. Self-care during postpartum. Nutrition. Preventing anemia, when and where to seek for care, breast milk and breastfeeding, family planning, newborn screening, role of father in postpartum and newborn care. 10. Encourage the mother to come back with her baby for return visits. Schedule the next visit and note it down on the mother and baby book. Remind her to return for the well baby clinic and immunization. First visit should be within 24 to 48 hours since it is the most critical period. All postpartum mothers should have at least 2 routine postpartum visits.